COVID-19 pandemic has caused a seismic shift in how we work. Even here at the Royal Media Services, for example, WFH, or work from home, has become a common catchphrase indicating just how much things have changed. Now, here in Kenya, as more workplaces report positive COVID-19 cases, the way we work has come into sharp focus. For many Kenyan laborers, working from home is not an option. As the pandemic persists, how can employees keep safe while staying productive? Victoria Rubadiri tells us more.
Rare scenes of a dormant Huduma Center GPO. On a normal day, this government service center is a beehive of activity. Today, the government temporarily closed it for fumigation. The reason, according to a statement from the Ministry of Public Service, was, quote, the rising number of COVID-19 cases and high customer traffic in the past week. It joins a string of government offices and firms that temporarily shut down operations to get ahead of the spread of the coronavirus. The workplace now appearing to be the new epicenter of the virus. Its effects on both people and profit very evident since the pandemic hit Kenya over 4 months ago.
Some businesses unfortunately have had to fold. Others, on the other hand, a few have flourished, but most are, in a manner of speaking, gasping for air and struggling to recover. And the impact of this has been lost livelihoods through job cuts.
For those who still make the commute to work, the new precautions like wearing masks, social distancing, and washing hands became the new normal. However, even with these measures, workplaces have recorded some positive cases. This has seen companies send infected employees home for isolation.
All the employers, the small-scale or large-scale employers, need to reassure their staff that if you either get infected or you're exposed, you will get paid for all the days that you stay at home. That is going to allow them to be truthful, to be honest, to come and take their temperatures, or even if they're feeling a little bit unwell, that they'll stay at home because they're not losing any benefits or anything.
This, Dr. Njenga says, will help workplaces better contain the spread. However, he does stress working from home is the best preventative measure, and it comes with its benefits.
And our productivity has actually gone up by 25%. By learning to work virtually, to work online. It has removed, for example, the commutes that our staff do. Sometimes you spend an hour or 2 hours commuting back and to and from work. Sometimes it's even 4 hours.
For other laborers who earn a living in less structured workplaces and don't have the luxury of working from home, the burden to keep safe is even heavier.
That is a real issue because they don't work in offices. Some of them are working in kiosks. Some of them are working in the construction industry on the road. And those are difficult to talk about, things like social distancing. They're helping each other. They are really working closely together. We also do owe them some safety. I think there's some safety measures they could employ. One of them is to really build a culture of wearing masks and routine sanitization.
As the pandemic shows no signs of slowing down, it is evident workplaces post-COVID-19 will never be the same. And perhaps working cultures will finally make a shift to prioritizing employees over the bottom line. Victoria Rubadiri, Citizen TV.